أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم. Today we are going to discuss equine infectious anemia. Equine infectious anemia, this is mostly present in horses. This is a very chronic disease following an initial acute attack. This is caused by retrovirus, which can be demonstrated in blood probably for the rest of horse's life. Regardless of clinical evidence of disease, this disease is mostly present in Europe and less commonly present in UK and subcontinent. This retrovirus is very resistant to disinfectants and this is very resistant to heat. This virus withstanding boiling for 15 minutes but not sunlight and remaining viable for years in blood or the frozen. An incubation period of 2 to 4 weeks is usual following natural infection. Clinical signs. So far as the clinical signs of equine infectious anemia is concerned, there are three forms of the disease. Number 1, acute form. Number 2, subacute form. Number 3, chronic form. And in acute form, constant fever is present up to 105 degree Fahrenheit or more than that, but may fluctuate rapidly. Number 2, there may be weight loss. And number 3, anemia may also be seen. Lack of blood may also be observed in acute form. Number 2, subacute form. In subacute form, fever for the period of 1 to 7 days with return to normal for variable periods is a main clinical sign. Number 2, anorexia. Number 3, ventral edema. Number 4, depression terminally. And number 5, jaundice or myocarditis may also be seen in this equine infectious anemia subacute form. And lastly, weight loss is also seen in this case. Number 3, chronic form of the disease. So far as the chronic form of the disease is concerned, recurrent febrile episodes may be seen. Number 2, weight loss is also seen, and anemic condition of the animal is also observed. Next is the diagnosis. Clinical diagnosis is difficult, but because it requires repeated observations, and laboratory diagnosis is possible with the help of Coggins test. Coggins test, COGGINS, Coggins test. Differential diagnosis. This disease, equine infectious anemia, which is caused by retrovirus, this disease should be differentiated from babesiosis, number 1, and number 2, purpura hemorrhagica, and number 3, leptospirosis. Treatment. There is no specific treatment of this equine infectious anemia because this is a viral disease. But supportive therapy should be done, including blood transfusion. This blood transfusion may assist clinical recovery. Prognosis. So far as the prognosis in acute form is concerned, mortality rate is about 50% in acute form with animals dying in 10 to 30 days. And in subacute form, period of normal temperature followed by exacerbations of the disease until the animal dies in 2 to 3 months. So note it please that in acute form, animal dies in 10 to 30 days and mortality rate is 50%, and in subacute form animal dies in 2 to 3 months. And yes, period of normal temperature is followed by exacerbations of the disease. And in chronic form, gains weight and returns to apparently normal condition between febrile episodes. There can be exacerbations of clinical signs at any stage. Asymptomatic carriers following recovery from clinical disease may carry the virus. Despite apparent clinical normality, but act as sources of infection for other horses. So, in chronic form, the horse may act as carrier, may act as a sources of infection for the other horses because virus is present in that particular horse, and that horse may act as a source of spread of the disease in other horses. Next is the control, and very important. Control is very important, avoiding taking horses from exotic to clean areas. So please avoid taking horses from exotic to clean areas. This is first controlling measure. Second one may be that Coggins test on all imports should be applied. And number 3, limit insect vectors. And number 4, avoid mechanical spread like syringes and needles. So avoid mechanical spread of the virus through syringes and needles. Suspected animals should be isolated for at least 45 days, and it is preferable if they are isolated for 90 days. This is the last controlling measure, that suspected animals should be isolated at least for 45 days. And it is good, it is more preferable that if they are isolated for 90 days. This was a little bit about equine infectious anemia caused by retroviruses. Thank you very much. Jazakallahu khaira.